Okay, we're back, we're live. Here we are in ThinkTech, and it's a Tuesday, and we're here in Hawaii, the state of health. We like to be healthy. We here in Hawaii, we'd like to live 1,000 years and be as healthy as we can possibly be. And it comes that way as a matter of culture. I know this because I have interviewed many people from the Department of Health, and if you guys didn't know it, in fact, health is our middle name. You know, we are a healthy state. Knock wood, knock wood, knock wood, yeah. Okay, and today we have immunizations and public health, with, starting from my left, Jan Nishihira, public health nurse. Say hi.
Hi.
Nice to be here.
Nice to be
I've
here.
been waiting all week for this. Okay, that's Jan. And next to her is Christina Stefanov, also a public health nurse. Say hi.
Hello.
And next to her, at my far left, is Holly Ann Kataoka, also, this may surprise you, a public health nurse. Hi, Holly.
Hi.
Okay, so first thing is, if anybody has questions or comments, yes, they can reach us. All they have to do is a Twitter thing, and I will see it right away, okay? And that is ThinkTech HI, ThinkTech High, okay? So somebody out there, you can do this under the table if you want, just don't look down, you know. It's like tweeting while you're driving. But they will, you know, they will tell me it's on our Twitter feed, and I will be able to answer them and acknowledge their comment, okay? And that includes the people here who are in the studio who are observing us. They can send tweets also in a way of communicating to us. Okay, let's first find out what it is to be a public health nurse for the State Department of Health.
A public health nurse.
Yeah, public health nurse.
Well, basically, we do community health nursing. So we look at our communities, we assess what their needs are. We try to collaborate with other agencies or community agencies to provide for the needs of our community.
Okay, why are you doing this instead of being an oncology nurse in Sloan Kettering in the Upper East Side of Manhattan? Why?
It's just the love of community health nursing.
You like doing it?
Mm-hmm.
What about it do you like?
You get to work with the people, you get to learn about the community, about the history. It's just some kind of...
So you interact with people. I think if you've been in the hospital, then you get to see a different side of nursing when people are discharged, or, you know, how they are in their homes and how you can help them in a different setting.
So it's special when you go out into the community, and that's an appealing part of being a public health nurse, eh?
Yes.
When you get to see people in their own setting, in the hospital, you see them in the hospital room and you provide for their care there. But when you're out in the community, you can actually, when you go to their homes, you see what resources they have. Do they have other family members that can help them? It's just really trying to pull everything together to try and help a family or a person.
You like the helping part then?
Oh yes, definitely.
Yeah. Dealing with families, dealing with people
Mm-hmm.
on the ground, yeah.
Mm-hmm.
How about you, Christina?
That's my driving force, is
Yeah?
that caring.
Yeah. So how is it different, though, than being an oncology nurse in Sloan Kettering on the Upper East Side of Manhattan?
Oh, many differences.
Yeah.
For me, I see we work a lot with families in their homes, so we're not just working with the patient, we're working with the whole family as a unit. And we don't see a lot of short-term outcomes or goals. We see a lot of long-term things. So, for instance, diabetes or asthma, we may not be able to, you know, give the insulin and see a outcome, but we teach, we educate the family and the client, and hopefully they'll be healthy.
I'm getting something on this. I'm getting the fact that you see them again and again. They are your patients.
Yes.
You see them, you see the family grow old. You get to meet
We
them and
can.
service them and care for them over and over again. Yeah,
Yes,
that's special.
it is special.
You don't have that in Sloan Kettering. No. Okay. And what neighborhood do you service? All neighborhoods?
Well, we work in 3 different sections.
Okay.
I work in the Leeward area, and Christina works in the Windward area, and Holly works in the Central.
Central?
Mm-hmm.
was that Kataoka? You handled the $15 million condos? Is that what-
So more from about Salt Lake to North Shore.
It's quite a lot of territory.
It is.
Yeah. So, okay, so now you go out to see them once in a while,
Mhm.
but you like for them to come and see you too. You have what, 3 separate facilities or one facility? Where is, you know, when they come to see you, where do they come to meet you? Where?
Well, on Oahu, we have different sections. So we have ours in the Leeward area. You have one office, right?
We have one
And
office.
Central Oahu has
2 offices.
2 offices. They have one in Wahiawa, one in Pearl City, and then there's one in East Honolulu and one in West
Oh,
Honolulu.
that's plenty then, yeah.
Mhm.
Okay, and how do I, if I want to, in this case, get an immunization,
Mhm.
okay, how do I start the ball rolling on that?
So actually, our immunization clinics, we work with the Hawaii Immunization Branch, and we work as a VFC provider, which is a vaccine for children's provider. It's a federally funded program that allows us to immunize children at no cost. And so it is only from birth through 18 years old, and they need to meet one of the qualifications for the VFC, or the Vaccines for Children program.
What is the qualifications?
So, no insurance or Medicaid.
It's impossible now, isn't it? Under Obamacare, there must be insurance, right?
We have a lot of people with no
That's still-
insurance.
Well, you heard it
Yeah.
here on ThinkTech. Even though it's supposed to, sometimes they don't. Okay, anyway, go ahead.
And there are a lot of reasons for no insurance also. I'm sorry, I lost my train of thought.
The reasons you
the
can
qualifications.
come.
The Native, they're either Native American or Alaskan Native.
Underinsured or Medicaid or Quest. They have those insurances.
Okay, so it's free.
It's
Now,
no
if it were not free, I don't know if you know the answer, but if it were not free, what would it cost? Is it expensive?
It
to get?
depends. The price of the vaccine is different depending on which ones.
Right, and if I have insurance, then it's a little tiny copay anyway,
Mhm.
right? Not a lot. But if I don't have insurance and it's not free, then it could cost me some money. You know, there was a thing on 60 Minutes this past Sunday about the cost of some of these cancer drugs. $5,000-$10,000 a month, would you believe? Right?
Mhm.
Even more.
Yeah, and then they attacked the big pharma companies. So how do you set that price? Well, we have to recover our investment. Yeah, but how did you set that price? Well, we kind of made it up. And these poor people, you know, they can't even afford the copay. I mean, drugs are going to be reformed in this country, you will see. And after the first time 60 Minutes covered this, all of a sudden there was one drug company that cut its price in half right after the show. The power of the media. And you could have the same power here today on ThinkTech. Okay, anyway, so let's go to immunizations. So what is an immunization? Anybody?
Well, an immunization is when you're taking either a weakened virus or a portion of the virus and making a solution with that to inject into the person, and that will trigger the body to make antibodies to that, so that without creating disease.
So you want the immune system to react to this substance you're giving the person and create the antibodies that will deal with the disease.
Mhm.
Very
And so
clever.
the next time the body encounters the virus or the disease, it will already have the protection from,
So it lasts longer than a short time. I mean, this could last for years
yes.
and years, even for life, even.
Yes.
Mhm.
Okay, this is very healthy. So, now you're focusing on children. I mean, I don't know if an 18-year-old kid's still a child, but okay, children. And what kind of diseases do you want to immunize that child against?
There's 16 that we have vaccines for, so do I name all of them? Okay, you're gonna have to help
Well,
me here.
name as many as come to mind.
Measles, mumps, rubella, chicken pox, diphtheria, tetanus,
Pertussis.
pertussis is a big one.
Varicella.
chickenpox, varicella. There's hepatitis A, hepatitis B, meningococcal, pneumococcal,
Human
hib.
papilloma virus.
Oh yeah, human papilloma or HPV. Did I miss
Influenza.
any? Influenza. Rotavirus is another one. Did I name them all?
That's all.
Sounded like about 16.
Okay.
Good work, Christina. Okay, we're gonna take a short break. We're gonna come back, and we're gonna talk about how you pick the immunizations you wanna do for a given person. And whether you do them all at one time, you know, you can say, would you get on the table there? I got 16 things I wanna say to you, you know? Or do you do it at seriatim and you do it over time? I want to know about that. Okay, this is ThinkTech. I'm Jay Fidell. We're serious here. We're doing immunizations and public health. We have public health nurses, 3 public health nurses, and I feel safer, more healthy than I have felt in a long time being in their presence, okay? We'll be right back.
Aloha, my name is Josh Green. I'm a senator from the Big Island. I work in the ER there. Aloha, my name is Josh Green. I'm a senator from the Big Island. I work in the ER there. But on Tuesday afternoons, I get to come and spend 45 minutes to an hour with Jay Fidell and the ThinkTech staff. They're terrific professionals. They help us to bring some of the leading cutting-edge topics here across our state to you. So you can join us at our show on healthcare in Hawaii to talk with leaders from across all the spectrum of health in our state, or you can join us for any other show where we talk about economic development or tourism, or some really eclectic programs too. So really, we'd love to see you here on our show. Thanks for joining us and thanks for supporting us.
Aloha, I'm Hunter Hevelin, host of Sustainable Hawaii here at ThinkTech Hawaii. You can tune in every week on Thursday at 2 p.m. to see interviews with sustainability professionals from around the state and even further abroad, learning about activities with water management, food security, waste management, and a whole host of other fascinating opportunities to get engaged with making a greener island. So if you're interested in making the transition from consuming individuals to communities of producers, check us out every Thursday. Aloha.
Okay, we're back. We're live. We love to be around nurses because they're always such nice people. I never met a nurse I didn't like, actually, including you guys. So, okay, so how do you decide what to give what kid, actually? You let the kid decide?
I'm
In
sure
that
if-
case, it'd be 0.
Yeah, it would be 0 if we let the kids decide. No,
Sorry?
but we follow the CDC recommended schedule. So based on their age, they would, it's recommended that they receive certain vaccines at that time.
Okay,
Usually-
so it's a sequence. And when you're such an age, you get this one and that one. And when you're such an age, you get that one and this one. And so, I mean, is it that you finish all the 16 shots or whatever shots are appropriate by a certain age? Or do you keep on getting these shots? And how does that work?
Certain vaccines finish, but there's others that you need a booster. For instance, we have our elderly population and they need the shingles vaccine or the pneumococcal vaccine. So there's certain ones that need a booster because it doesn't last their entire lifetime.
So how does the event, get started? I mean, is it somebody walks in and says, I need a vaccine. I feel it. I feel like I need a vaccine.
Well-
What happens? How does that work?
Well, for our clinics, the kids are normally referred to us by another program, or our information is also up on the DOH website on when our clinics are scheduled. So some parents will call saying, hey, I don't have insurance anymore. Can I bring my child there to receive vaccinations? And so we would schedule appointments to have them come in.
Okay.
And then at that time, the nurses will look at what vaccines the child already has, or if they don't have any.
You have the child's records.
So we ask parents to bring that in also.
Mhm.
And based on that and their age and what they already received, then the nurses will determine what is appropriate for them at that time.
Okay. Okay, and then the nurses will administer the injections.
Yes.
Okay, so is it always the same thing? You take a little glass or plastic bottle and you stick the needle in?
There's
Draw
many
the
different
fingers.
vaccines. There's
Various.
the flu
Really?
mist is a spray up the nose.
Yeah.
Rotavirus can be something that's
mouth.
oral. Mhm.
Some are already in the syringe, so we just attach a needle and give
Oh,
it.
So every different kind, yeah.
Yes.
You know, in the old days with Dr. Kildare and everything.
You're dating yourself again.
Can't help it. It's compulsive. They used to say, you know, you lower your pants, please, and okay, you guys still do that? You still need to do that, or we have other ways? We have other ways to do that now.
If it's intramuscular, we look at, for the little ones, we look at the muscles on the thighs or on the arms for the older kids.
Okay, so there are different spots that you inject for different kinds of
Yes.
immunizations. Okay. Now, what about the kid who's afraid? What happens? I mean, how do you know he's afraid?
Oh.
Just say, I'm afraid.
Sometimes they do say they're
Yeah,
afraid.
yeah.
Or they come in and they're crying and screaming already. So we work with them and their parents, and we try to calm them before they come in, and we have the
During.
parents hold them a certain way to help us vaccinate safely.
Yeah.
Safety is
You don't want
always-
them moving when you vaccinate them.
Right.
Yeah.
We don't want to hurt them in the
Yeah.
process.
Yeah, that can hurt. Yeah, you get a needle in you. Yeah.
So I think it's built up anxiety sometimes. Because sometimes when we give them their vaccine, they don't even know we've done it. And they'll ask us, when are you going to do it? It's done.
That's
Or
the
putting
best.
the Band-Aid on.
That's the best. That's the velvet touch. It must be a way to fool them about that, you know? So almost ready, oh, we're done. Yeah, so, okay, so now you have allayed their concern, and now they're walking out and they say, oh, that hurts. I don't know if they say that. Do they say that? And if they say that, what do you do?
We give them a sticker.
A sticker, not a lollipop?
Oh, no.
I'm dating myself again.
Lollipops are not healthy.
Thank you. I'm dating myself. Maybe,
No,
but not you.
We do have them wait outside of our clinic for 15 minutes to be sure that they're okay. And then after that, they'll come in, see the nurse, and then they can go.
For every shot. Because you don't know how they react to it. Yeah.
Mhm.
And sometimes they get some kind of shock reaction.
Yep.
And that's, you want them nearby so you can treat them if that's necessary. So does that actually happen? I know, you know, I know every doctor would do that, but. Oh.
Yes, it's very rare though. Anaphylactic shock is an occurrence, but it's very rare.
How does that work? What happens?
Well, it's an allergy to one of the components to the vaccine. So in that case, you would, even if like an allergy to eggs or strawberries, you'd have the difficulty breathing, hives.
It's rare though, because.
Very
Well,
rare.
because kids are not, they're not, what do you call it, allergic to that anymore? Or because the quality of the product is such that it's not likely to happen, or what?
Yes, they've ran so many tests on these vaccines to prevent that sort of reaction.
Okay, so you really don't have to worry, but you make them sit down in the waiting room, and for how long was it, 5 minutes, 10,
20?
20? Just want to see if there's any reaction.
Yes.
And then take a look at him again, and you see if his face is red, whether he's coughing, for example. Did you guys take a shot on the way down here? What are you looking for?
It's mostly difficulty breathing, the hives, passing out.
Flushing, itching, they're all different
There's
kinds.
so
I mean,
many.
sometimes they'll,
Sore stomach, vomiting, it ranges.
Yeah.
So any kind of symptom that they're having, we
Okay,
We'll
now,
take a
that's
close
20
look
minutes.
at it.
Suppose the kid has, I mean, is it possible the kid had that as a delayed reaction? In other words, he gets in the car, they drive home, and then he gets hives. Is this possible? Or will you be able to catch it all in the 20-minute period?
probably possible that it could happen, but before they leave our clinics, we always try to tell them that if there are certain symptoms, if they're having fever, or if they're having any kind of reaction, then they should go to the nearest emergency room.
Yeah,
Yes.
sure. Yeah, because it can be, potentially, it can be pretty, anaphylactic shock could be serious, yeah. Okay, so what happens after that? You make a note, now it's in the file, and now you're going down the path as the kid is getting older, and you see in the next year, your protocol calls for another shot or 2 or 3. You call them back?
Well, our immunization clinic is not just for vaccinating them. So while they're with us, we try to get them hooked up to medical insurance. And so we start that process.
So this is actually a way for the state to connect
Yes.
with the public
Mhm.
and to bring them into the system.
Mhm.
And so it's got all kinds of other benefits for you, for the
Yes.
state. Yeah, that's really good. And so, and people, are not particularly threatened by shots. They feel they should have shots. We all had shots. And so, a short story. And so, this is a great way to bring them into the system. When I came out here, which was October 1st, 1965, you were only 26 at the time. Joke. Sorry. I was in the service, and they said, you can't just go to Hawaii. You can't do that. You have to get shots to come to Hawaii. This was way back when, people don't remember this. So they made me stop at an Army base in San Francisco, and they allocated 3 or 4 days that I should stay over in the Army base in San Francisco. And what did I do all day? I got shots, one shot after another. They had me so shot up. By the time I got here, I was sore in both arms. And you probably don't remember that, but that's the way it was. If you came to Hawaii, and this is just after statehood, you got shots. At least you got shots in the service. I still don't understand why, but that's what happened. Okay, so you reach them, you have them in, you open a file for them. Now the state of Hawaii is connected, health-wise, to this kid. What does that mean in terms of bringing him or her into the system?
Well, we try to reach not only them, but their family. So the client is actually not just the person who's being immunized. It's actually the family. So we're trying to get medical insurance if needed for the whole family. And so the family members who don't have medical insurance right away, we also provide them with other agencies that they would be able to seek medical attention at. The low-cost medical clinics or the federally qualified health clinics. So we try to keep the entire family healthy.
So the child is only an access point to the whole family.
Mm-hmm.
The child's immunization is only a connection. It acts as a connection. That's terrific. That's a really good idea. So how many people do you reach? How many vaccinations? I guess we're talking Oahu right now, but how many vaccinations? Any idea about that?
It's different per section.
Okay, well, your section.
My section, we see every month up to 5 a month. It's very low because we found a lot of our population has been getting insurance and hooking up with these medical providers. So that's Windward. And then Leeward.
We've seen a recent decrease also, but we see anywhere between, I would say, 10 to maybe 18 or so a week, every Monday.
Oh, okay. Okay, Monday is your shot day.
For us.
Yeah, okay.
Every section has a different thing.
Okay.
For Central, we have 2 offices. We have 2 clinics, but it's only once a month each. And probably it ranges from about 5 to 16
Yeah.
in the clinics.
Okay.
So it varies. And like Jan was saying, our numbers have decreased. And that's a good thing because that means that the families are getting medical insurance,
Sure,
so they
right.
are seeing a medical provider for other health reasons.
The other thing is, it seems to me like there are other, I think you mentioned, there's other organizations in the community that send you people, right? So, for example, if I put my kid in school, the school's gonna ask him, you have shots? You have inoculations, immunizations? You know, and he can't show, or he says, no, I never had that. They're gonna refer this kid to you or to a doctor under insurance, but the school is going to insist, right?
In order,
that he
yes.
get appropriate immunizations. And that's the point I want to talk about next, you know, is that whole measles thing in California and elsewhere in the country, and to some extent here, where for religious reasons, parents don't want their kids to get shots. And in California, I don't know if it happened here, but in California, kids were getting sick for the lack of shots and infecting other children in the school. And so there was a question about, you know, should we, A, allow them in school if they haven't had shots, and B, require them to have shots. It's a serious public health question, and that's what the State Department of Health is all about, public health question. So when I ask you, you know, what do you see as the importance for immunizations in Hawaii and the U.S.? That's a framed question, okay? What's your answer to that?
Well, the importance of immunizations anywhere, not just Hawaii and the U.S., is that it prevents, it's a primary prevention for communicable diseases, to prevent the spread of these communicable diseases. And I think nowadays a lot of people haven't seen these communicable diseases, and they don't know what, how much illness it can bring on, or the side effects of these illnesses. So I think maybe views change, but as far as the importance of immunizations, the more people who are immunized, the less chance of these communicable diseases will have to spread between individuals. And by that, we not only keep our children healthy, our communities healthy, but we also provide some form of protection for the people who cannot receive immunization, such as newborns or people with chronic illnesses. So it is a very important part of public health.
But not every single shot is going to prevent, is intended to prevent an outbreak. Some of these shots are just personal, right? Some of the shots you were mentioning, they just help you in your own personal health. It's not like what you're going to have, a communicable disease. Right? I mean, there's a mixture of things here. When I was a kid, back to my dating myself, there was a summer camp in Brooklyn. I was in Queens. And I want to say it's Camp High was the name of this camp. And the cook in Camp High was a walking typhoid carrier. And a cook, imagine a cook who's a typhoid. And they named her Typhoid Mary.
Oh my goodness.
You remember that? Typhoid Mary. And there's, you know, hundreds of kids were coming down with typhoid. This was the 20th century. You don't have that. But it's entirely possible that, you know, you could have an outbreak among kids. And people forget Typhoid Mary. They forget what happens, you know, if you don't. What happens if you don't? What happens if you scrap the 16 things? We don't offer that anymore. Nobody offers that. No need. For whatever reason, religious or otherwise, we don't take needles, we don't take immunizations. What happens to public health?
Run the risk of widespread diseases.
Yeah, I think we forget.
Yes.
It's funny how you take it for granted after a while, but if you roll the clock back, say 100 years.
Even less than that.
Yeah, it was really dangerous. And life was different then when you ran the risk of being involved in an epidemic. Yeah. So let's take on that hopefully better day kind of comment. Let's take a short break, okay? This is Jan Nishihira to my left, and to her left, it's Christina Stefanov, and to her left, Halian, Kataoka, all public health nurses, all doing great community service, you guys. We'll be right back after this break.
Hi, I'm Ethan Allen. I'm the host of Likeable Science on ThinkTech Hawaii. We talk about why people should like science, why science is actually fun, how science is a dynamic and vital part of everyone's life, why everyone, every man, woman, and child on the planet should really know science, should love science, should be familiar with science. So it's a great show. People come on here and have interesting conversations with us. They tell us why they do what they do, why they love it, why we should love it too. I hope you'll join us every Friday, 1 to 2 p.m. And of course, you can see it anytime on YouTube. Aloha.
Aloha, my name is Josh Green. I'm a senator from the Big Island. I work in the ER there. But on Tuesday afternoons, I get to come and spend 45 minutes to an hour with Jay Fidell and the ThinkTech staff. They're terrific professionals. They help us to bring some of the leading cutting-edge topics here across our state to you. So you can join us at our show on healthcare in Hawaii to talk with leaders from across all the spectrum of health in our state, or you can join us for any other show where we talk about economic development or tourism or some really eclectic programs too. So really, we'd love to see you here on our show. Thanks for joining us and thanks for supporting us.
We're back, we're live, we're having such a good time here on Tuesday. Me and my nurses. I never go anywhere without my nurses. You know, I knew a guy used to go hiking, you know, and way up in Tibet and all that. He always took a doctor and a nurse with him. He had a lot of money. He always had good health. You know, you break a leg, no problem, we fix. Okay, so let's go back to exactly what's happening here. And somebody is determining, probably in the State Department of Health, what diseases are where the community is at risk for, and what conditions we should try to prevent against, so that people have a better quality of life. So, and the epidemic diseases are obvious, but so are the other ones obvious, especially in elderly, you know, who need to have protection against the deterioration. So I guess I'm asking, do they change? Do you get a new list? You have a committee. You have a committee that sits and talks about this, don't you? Tell me about the committee.
Well, our immunization committee within public health nursing branch discusses the issues that we see. As far as the requirements for what kids need to get, that is a recommendation from the Center for Disease Control.
Oh, Washington.
Yes, so that is a recommendation that comes out annually at the beginning of the year, and they have the schedules with the recommended ages and vaccines to get at those ages.
Okay, so and you accept their recommendations?
We follow along with what the Center for Disease.
It wouldn't be a good idea to say, I don't think so. Okay, so they make recommendations of the 16 or whatever, okay, and then the State Department of Health follows through on that. Okay, now, and some of them, do they change? Have you noticed? You guys have been in the business for a while.
Oh, yes.
What kind of changes can you recall to tell me about?
Well, in the last 5 years, we've added the human papilloma virus. We've added hepatitis A to the list. So every year we don't know what's coming, but we know there are new ones coming down the pike. Human papilloma
What is
9,
what is
HPV. So
HPV.
yes.
So the human papilloma virus is a virus that is sexually transmitted, but it is a known virus that causes cancer. And so this vaccine will prevent, currently it's
4.
the current vaccine prevents 4 strains of this.
Papilloma virus.
Yes.
Yeah.
And which are known cancer-causing viruses.
So I'll have some of that. That sounds like a great thing. I mean, there's no downside, right? But is the public getting this? I mean, if I walk up and down the street, has everybody got this, or what? I mean, maybe it's a recommendation, but it's not a requirement. Are doctors recommending this for the entire population?
Currently, it is a recommendation.
Okay, gee, that would sound like a really good thing. I better talk to my doctor immediately. Do you mind if I make a call? Okay, all right, so you're changing. You add on the
Every
CDC
year,
and they
yes.
tell you, what about subtracting?
Well, I think the only thing we can say about that is that, excuse me, they do have combination vaccines, which means that the child would get more vaccines in one shot.
Oh, okay, combinations are important. So give me an example of a combination.
So an example would be Pediarex, which has diphtheria, tetanus, acellular pertussis, hepatitis B, and inactivated poliovirus.
vaccine. What did you call it again?
Inactivated
No,
poliovirus.
Peter X, what?
Oh, Pediarex.
Spell.
PEDIARIX.
Okay, Peter X, of course. And these are common, these are vaccines, immunizations that you would give anyway.
Right.
So it's a matter of convenience to put them in one combination.
Yes.
Yes.
Okay.
So, which is less shots for the child.
Yeah, that's a lot better. But does the combination of immunization vaccines in there change, or does it stay the same? I mean, the thing is, they could change one, add one, subtract one, what have you, with the Peter X thing. And you
They
wouldn't
have-
even know necessarily.
They have different brands, but as far as the brand itself, the antigens doesn't change. So the vaccine that's inside of that one combination will not change. If you want to use a different combination, then there are different brands.
Okay. All right. So, is this going somewhere? I mean, what I mean is, what's the general sea change on this sort of thing? Are we going to have more vaccines over time, or less? I mean, what you guys have been doing it for a little while, so you can tell me, if you would. Are we going to wind up with having kids take a lot more drugs, a lot more vaccines, or fewer vaccines over time? What do you think?
I would imagine that in the future there would be other vaccines for diseases that would be preventable. As far as more combination vaccines, that I'm not sure.
Yeah, well, maybe though. I mean, I guess at the end of the day, it's not only the inconvenience, but the money. Because somebody has to pay for these vaccines.
True, true.
Who pays for the vaccines you guys administer? State of Hawaii? Or
Um,
federal government?
Federal government.
The
government.
Vaccines for Children program.
Yeah. And do they have useful lives? In other words, temperature. Temperature. You mentioned that one of the reasons you don't go out into the field with a little doctor's bag of vaccines is some of them have to be very cool.
Yep.
So, and that's why you like to administer them in the office, yeah.
Cold chain is very important for vaccines to make sure that they're viable.
Yeah.
Yeah.
How long do they last? You have
Each
to
one
throw
is,
them out after a while.
each one has an expiration date.
Oh, it says it like a quart of milk. Yeah. Okay. All right, so you talked about the committee, and I got it now, that the committee does not determine exactly what you are administering. What does the committee determine? This is a committee of nurses, right?
Public health nurses.
Public health nurses, okay. What do you talk about? The weather? No.
We talk about different ways I think we can serve our community, what
Yeah.
challenges we might have in our different sections. So our committee is actually island-wide, or well, I should say statewide.
Statewide?
So we have.
Okay. So public health
representatives.
nurses in the system.
Yes.
Meeting every so often to talk about, and it's not just vaccines, right? It's all manner of help that you
Right,
give
about
people.
our clinics, how
Yeah.
our clinics are running, what challenges we might be facing, how we can better serve the public, those types of things. And then we share information, I think just to, like I was saying, better serve our community.
Well, yeah, I mean, it's like all of medicine's like that these days. It's like evidence-based nursing, right? You look and see what's happening, you get a hard copy, and you figure out how you can do it better, always better. That's our motto too. You know, ThinkTech Hawaii, every day better. Yeah, sure. I'll show you the sign. So what kind of a career you guys have? We have a couple of minutes left, and what is it like? How do you see it going forward? You're all young now, but how do you see it going forward? What is it like to work in the Department of Health, and should they sign up?
Community health is interesting because it always changes. Communities never stay the same. The people change, the needs change, and with that, your interventions have to change. So it's a continuous assessment of your community, what their needs are, what your resources are, and how you can put everything together to make sure that your community stays healthy. If you want a challenge, come to public health nursing.
Yeah. When you walk down the street or, be in a crowd, do you see them all as your clientele, that they are the community, and you have this kind of interesting kind of responsibility for them, or you kind of like in loco parentis, you sort of, these are my charges, these are the ones I'm here to take care of. Do you see it that way when you walk down the street, see a crowd of people? Those are my people.
You can't help but feel a connection to the community that you work with.
Yeah,
Yes.
okay. So is it a full career for all of you?
Oh, yes, definitely.
Yes.
You're in, all in.
Yep.
All in.
All in.
All right. Wow. So if I want to be a nurse, is there any room left for me? Suppose I wanted to sign up. Suppose I really, really am impressed with what you guys do. I want to help people. I want them all to be my people too. So where do I go? What do I do? Is there a job available? Is it hard to get a job?
You can check the Department of Human Services.
Website.
Yeah. What should I read up in advance? Should I go to the nursing school up in Manoa?
They have a good community of public health.
Yeah.
Program.
Public health nursing, specifically in Manoa, in the nursing school.
I think it's a nursing program. Rotation.
Yeah, they have a rotation through community health.
Did you all go to nursing school?
Oh, yes.
Got to.
Yes.
Yes.
Okay. All right, and you all love your work too.
Yep.
Yes.
I got that really.
Mm-hmm.
Okay, so that's Jan Nishihira, public health nurse, and Christina Stefanov, public health nurse, and Holly Ann Kataoka, public health nurse, making our community healthier. Thank you very much, ladies.
Thank
Thank
Great
you.
to have fun with you this morning. Aloha.
Thank you.
Thank you.